Visionary.
Game changer.
Disruptor.
A leader.
Role model.
Compassionate.
Expert.
Heavy hitter.
Advocate.
Ambitious.
Driven.
Exceptional.
Personally, to me, being a champion in healthcare means treating the patient as a whole and not just a list of their symptoms, trying to catch diseases in the preventative phase rather than letting them turn into chronic conditions that then further impact the patient's quality of life.
Being a champion in healthcare means going above and beyond for your patients. That means seeing them more than just a disease that they present with, but rather as a person as a whole. They have a story, let them tell the story, and use it to help guide your treatments.
Being a champion means rising above and fighting and really putting your best foot forward every day for the benefit of other people, and that takes perseverance. It's not an easy path, and I think the ones that get to that point are strong-willed. I think they have great compassion, they have empathy for their patients, they're sympathetic to their colleagues.
Being a champion in healthcare personally means to me that I get to interact with patients each and every day. As I walk through waiting rooms, as I meet them in exam rooms, I just love to meet the patients and hear their stories.
I think a champion in healthcare is a person who thinks about the patient as family members. They have compassion, they have empathy.
You should be well-versed and well-rounded in many different things, acting as a gatekeeper to your patient's health care, and you also have to build good relationships and rapport with your patients so that they do feel that you do have their best interest at heart.
It's someone who goes to work, gets a question that arises, comes home, and reads more about the question. Doing that, you not only help yourself learn, but also patient outcomes and future patients you will see.
They show up with a smile, they work, and they know what they're doing because they want to be doing it to help people. I think those are the champions of healthcare, just the ones that care.
Having the in it to win it attitude and having the I can do it attitude.
Thinking about yourself and their shoes, what they're going through, and you want to try to help them as best you can.
Hi, I'm Dr. Ivana Pravuka-Davis, and I'm the founder of Auburn Primary Care. We opened the practice in 2020, right during COVID, and we have flourished since with now 3 providers, all nurse practitioners taking care of patients.
My name is Mark Kosovar. I'm an anesthesiology resident at Beth Israel Deaconess Medical Center. I'm originally from a small town east of Cleveland, Ohio, where I got to experience how social determinants of health impacted the community. And from there, I wanted to pursue it in my education and integrate it into my everyday practice.
I'm Dr. Richard Burke. I am OBGYN. I work at Good Samaritan Hospital in Brockton. And I spend a lot of time with my 2 dogs. Funny thing, I actually bring them into the hospital sometimes at night. They're both registered therapy dogs. I think it's as much therapy for the patients as it is for my nurses and staff and myself.
I'm Lynn Eccles. I'm a practice manager at Hawthorne Medical. I've been here for 28 years. I started here at Hawthorne Medical as an extern student from a local college and have worked my way into a practice manager position. I'm very proud of this position. In this position, I've been able to help many patients and employees.
I'm Dr. David Clark. I've been practicing medicine for 24 years. I never grew up saying I wanted to be a doctor. I wanted to be a teacher, and so I went into teaching. I found it wasn't intellectually stimulating enough for me.
Ivana. Mark. Richard. Lynn.
David.
Peter.
You are our community champion.